Given the conversation that from the experts this morning, I want to give all my colleagues a chance to address the public here with respect to COVID-19 and/or the governor's action. Does anybody want to speak? Councilmember Flanagan.
Thank you, Mayor. And I think given the presentation that we got this morning and all the information that we're hearing about the governor's orders, it is really important that our community continue to stay in place for all of those who can continue to stay in place. We have a lot of work to do about protecting our most vulnerable residents, certainly those who are older, but also those who have medical conditions that put them at higher risk. I want to talk just a little bit to business owners who are going to be faced with a very difficult choice. Now that the governor's orders seemingly allow them to reopen, it does put their employees and their customers at increased risk of transmission during this period. And I commit to continue to work through at the local level whatever programs we can to help support those businesses that choose to prioritize safety and health of their employees and customers. You know, as the governor, as the state and federal programs may or may not be available to you based on those decisions, it doesn't preclude local programs from helping those businesses that continue to make what I believe is still the right decision to prioritize the public health and safety, both for, again, employees and customers.
Thank you. Does anyone else want to speak? Mayor Pro Tem, I can't see you. Are you here?
Yeah, I'm. Can you?
Okay. Does anybody ready or want to speak at this point? Now I can see you.
Okay. Yeah, thank you, Mayor, for calling this special meeting, and the information was incredibly helpful as we continue to try to address this issue. I think most of Texas, after the governor's order, or many in Texas, left with more questions than answers when it comes to the latest orders. We've all, many of us know that there will be we won't have a return to normal of any type, and that this crisis has magnified so many inequities that many of us have been fighting for even before this happened. But allowing businesses to open, but the decision to allow some business to open even by 25%, I would have asked that we would have also, at a minimum, provided healthcare access to healthcare. 25% more access to healthcare, 25% increase in people's pay, the people that are in the front lines, the people that will be most affected by this. We're seeing the disparate impact, how this affects communities of color more because of their inability to access healthcare. And so at a minimum, any change should have included 25% expansion of Medicaid and Medicare. And not having that, Dr. Escott, I wish I would have, as soon as he said it, I wish I'd written it down, but he said we are putting the very people we are putting at risk are the ones that don't have access to healthcare, and forcing them to make incredibly difficult decisions about how they support their families and keeping themselves and the community safe. I think Austin has done a good job of providing support. We know that we are taxed. We are incredibly taxed as far as providing capacity building for our nonprofits. But we know that the RISE Fund is helping people, is going to continue to help people. And I appreciate how we've come together as a community, and we need, as a community, to stay this course. I know there's a lot of questions. I'm getting a lot of questions on conflicts of the new order and what we can and are allowed to do. But I would just greatly encourage our community to continue to wear your face masks, continue to stay home if you can stay home. Because the more we do that together, the more lives we save. And that should be at the top of all of our priorities. What decisions do we make to save the most lives? So I will continue to encourage my constituents to wear their face masks, to stay home, And I appreciate those businesses who have said that they will not open to protect their employees and to protect the community. Regardless of the latest announcement by the governor, they have decided to make the decision to not open. And so, Mayor, please let us know how we can support your efforts. And thank you for your leadership and the many hard decisions you've had to make during this time.
Thank you. Councilmember Kassar.
Thank you all. I think all of us have been hearing from small businesses that have been hurting. I think everybody wants to find a path to opening small businesses, but obviously we need to do that in a way that prioritizes everybody's safety and health. And the governor's action clearly doesn't do that because we have not significantly been able to ramp up testing and get the support to ramp up testing that we needed. We haven't been given the resources that we need to take care of those folks that are struggling, as the Mayor Pro Tem just described. And there is not yet the plan on how to protect those vulnerable workers who will be impacted by the governor's decision. And so I think from today's presentations and from today's session working with all of y'all, I think it's really clear the two of the really major tasks before us to save lives. One is to be prepared to close down non-essential businesses and really significantly get back to sheltering at home if we start to see our hospitals fill back up again. And I hope that we would have the governor's support in that, but when it comes to saving lives and when we're looking at Dr. Meyer's charts, I think we're gonna have to find a way to do that one way or the other if we start seeing that we're on a path that Dr. Meyer's called a catastrophic filling of our hospital rooms. And then our second task that's made really clear from the report this morning is that we have to protect those vulnerable populations. One, for just because it is the right thing to do and everyone is a person that should be protected, but also because if we don't protect vulnerable populations, the whole system breaks down for health for everyone in the city. That is people experiencing homelessness, people in our nursing homes, and then a group of people who I don't think there has been enough of a focus on yet, and that I urge the city manager and all of us to create a stronger program for, which are people with those underlying health conditions and our seniors who will be getting called back into the workplace. We absolutely need teleworking and staying at home for their health and for everyone's. And so we have both of those tasks. One, shutting down again if we need to, and it seems like our top experts say we might very well need to. And two, protecting those vulnerable populations. And so I echo everybody. I think there's unanimous support for these things, and I appreciate everybody's work. And I call on those employers to really think about continuing to keep your employees at home, everybody that can work at home, and especially not to bring in people into work who are feeling sick, who have a person in their household who is sick, or a person who is vulnerable. Those people absolutely need to stay home.
Okay, thank you. Councilmember Ellis.
Thank you, Mayor. It was really enlightening to get to see some more information from our scientists and researchers. It's important to follow their advice because they're able to show us how to flatten the curve. They've been doing a fantastic job so far, taking care of themselves and looking out for each other and their neighbors. And as we continue to monitor testing and medical capacity, it's going to be imperative for residents, workers, and business owners to continue to follow the best practices that have been set forward. Every day and every week that we continue to limit these social interactions is going to save lives. So please continue to do your best to make sure we're not transmitting diseases among each other. The longer that we can continue to do this and the more voluntarily people are following these best practices, the safer we're all going to be.
Okay, thank you. Anyone else want to speak? Councilmember Alter.
Thank you. I think we've all learned a lot from our medical professionals and our scientists. And I really want to invite the community to go back to ATXN and listen to what we heard this morning. And what we heard is that what we've been doing has been working. So I want to thank you for taking the responsibility to save lives seriously. So we've been staying home and we've been physically distancing in order to save lives, and it has been working. The evidence that we saw this morning, the evidence that the models suggest is that it's too soon to reopen in the way that's being proposed at this time. But we, despite not being able to put in our own orders that contradict the governor, ultimately this is up to us as a community to make decisions that promote health and well-being of our community. So every business can decide what promoting health and safety means for their particular business and making sure that their employees and their patrons are safe. And residents who are patronizing businesses have to make determinations about what's safe for them and to reward those businesses that make choices that keep our community safe. We are not helpless in the face of this order. We have been relying on your voluntary compliance all along. And if we continue to take measures that keep us physically distanced and we wash our hands and we do all of those things about staying home, we can protect one another and help us to navigate this pandemic. I want to note that we as a community are not only going to have to do the things to stay at home and to stay safe, but we also are going to have to keep pushing the envelope on testing and contact tracing. And there are a lot of things that we don't know at this point about how these orders affect our community. How are all these non-essential workers supposed to go back to work without childcare when their kids are not in school, for instance? There's a lot of unanswered questions, as one of my colleagues mentioned, and I think you have a commitment of all of us that we're going to work to try and find solutions and answers so that we can move forward as a community.
Thank you. Councilmember Harper Madison.
Thank you, Mayor Adler. I'll echo every single word that all of my colleagues have said thus far. I think this is one of those times where even despite ideologically not always aligning, we all understand what the concerns are here. We all understand what the risks are here, and we're all fully cognizant of the unfortunate situation that we find ourselves in. And so, yeah, I just want to echo every sentiment that's been expressed thus far and just really say, again, for the record, like Dr. Escott recognized earlier multiple times, people who are forced by way of economic pressures to make decisions to go to work right now, they don't have a choice. The fact that when we're making the determination around priorities and testing, that they're not at the top of the list. The fact that there's no requirement for hazard pay. I know that there's some organizations, including Cap Metro, that are making the voluntary effort to offer their employees hazard pay. I think it should be mandatory. I really appreciate that everybody that I know personally who recognizes that they have the privilege, the opportunity to make behavioral changes that keep our community at large safer. They're making those choices now. They plan to continue to make those choices, and I want to applaud them for their commitment to keeping our community safe and well. So thank you, everybody who's intending to keep up the hard work. We're all making sacrifices that are very important. And so I just want to say I really appreciate the leadership that our local leaders are taking, and that my colleagues and I are taking, and recognizing that even when presented a challenge that seems insurmountable, we're all taking the opportunity to be creative and innovative and keep the people in the city that we love protected and safe.
Thank you, Councilmember. Councilmember Poole, and then Councilmember Renteria.
Thank you. And I will echo all the previous comments. And I just want to say to the people of Austin, we really have a lot to be grateful here in Austin. It's because you have fully embraced the safety measures that we had described. That's what's helping keep our most vulnerable neighbors safe, and that's why we have so much to be grateful for. You all have done an amazing job, and I urge you to comply voluntarily with the steps that you've been taking so far. We need to stay the course. If we have even just 2 more weeks, or even just the rest of the month of May, with our voluntary compliance, staying at home and limiting our social interactions, we will be in an even stronger position in keeping more people safe and out of the hospitals and certainly off of the respirators. So the more that we can keep doing what we've been doing, staying the course, the better off we'll be. And recognizing how difficult it is for all of us, we're all anxious and ready to get back to work, like literally back to work, outside and in our normal daily habits and such. But I think even just another couple of weeks of staying in place will reap really, really great dividends. So thank you, everybody, for your voluntary compliance.
Thank you.
And I really want to thank Austin and I've seen a lot of people taking precautions, but I'm also very alarmed of what's happening here. Before Easter, the Hispanic population rate of infection was somewhere around 36%, which we make about 35% of the population in Austin. This latest report that just came out on the Shark today that I saw, we're at 46% now of infection. And, one thing about, the non-Hispanic population is at 48%. That means that if we increase our infection by 2 more percentage, we'd be tied with the majority of Austin. And people, I can't emphasize that you cannot go out and play soccer on Sundays. You got to take care of your families. You can't take the risk because you're going to be going back to work Monday, and there are going to be older senior Hispanics, they're having to work there at their work job, and they have to, work to support their family. I'm urging all of y'all that even, we're not supposed to have any kind of contact sports out there. And please wear your mask, and I wear my gloves too when I leave the house. It's very important. You want to save your family. Todos ustedes que están allá jugando, fútbol en los domingos, tienes que cuidar tu familia. Y si tú agarras el virus, luego, y tú no sabes, en toda la familia de ustedes se van a enfermar. So, por favor, cuídense. Thank you, Mayor.
Thank you. Councilmember Kitchen, and then Councilmember Tobo.
I also would like to echo what colleagues have said. I think that we are all on the same page and wanting to help all of us protect our neighbors and our family and each other. So, I just have a couple of things that I want to emphasize. We have achieved quite a bit here in Austin. We have been able to flatten the curve, but we have to remember that we're not out of the woods. We're not out of the woods, and we don't want to lose what we've achieved so far. So we have to be careful. We have to monitor closely the appropriate triggers. We have to ramp up testing and contact tracing. And we really have to be very proactive in terms of protecting our vulnerable populations. I am very disturbed, and I find it shocking the numbers that we have seen with our vulnerable populations. We have only to look at what's happening in our nursing facilities to understand that we're not there in terms of protecting our most vulnerable. And I think as another council member mentioned, this impacts the whole community. So when we're measuring our progress as a community, and when we're looking at triggers that will tell us whether we need to ramp up our protections or whether we need to, ramp up, staying home, all of those kinds of things. When we're looking at our triggers, we have to drill down and look at what's happening to the entire population of the whole city. Those triggers can't be just looked at in the aggregate. We have to look at what's happening to people living in our nursing facilities. We have to look at what's happening to people who are living on the streets and who are homeless. We have to look at workers who are vulnerable, who are facing choices between going to work, but have underlying health conditions. We have to take care of them also. And we must look at what's happening to the whole city in terms of people of color and people throughout the city. So if we're not measuring how we're progressing for the whole city, then we're not doing our job. I would also say that that recovery, we've talked about this some before. And as we move towards recovery, we have to be thinking about how we come out better. I mean, people have talked about this around the country and in our city also, but recovery doesn't mean going back to where we were. Recovery means being better, both at protecting our community, at becoming more resilient, at making sure that we address the conditions that make people in our city vulnerable. So finally, I would just say that I want to say thank you to the businesses who have been speaking out and approaching us and others about being thoughtful and careful in terms of how they reopen. I want to reiterate what one of my colleagues said, I think it was Councilmember Flanagan, about understanding the tough choices that businesses have to make and being there to be helpful to our businesses so that they can afford to put the kinds of protections in place that we need. So thank you to my colleagues and to our mayor for his leadership, and to all of you in the community. We've done a good job. We have to continue to do that job, and we need to ramp up the protections for our vulnerable populations. We've got to ramp up testing. We have to ramp up contact tracing. Thank you.
Sorry, Councilmember Tobo.
Thank you, Mayor. And, I wanted to just start by echoing my thanks to you, Mayor, and to our county judge and to the health professionals that have really guided our city's approach to this virus. The actions that you took were difficult ones, and they've really landed our community in a much better place than many communities across the country. And it is, with great concern that I think through how the governor's changed order might really impact that. So again, thank you for your leadership. I grew up in New York. I have most of my close family still lives in New York, and so I receive kind of daily updates. And the situation there is horrific and terrifying, and I am so appreciative that our community is not in that same place and facing those same really challenging choices and just terrible tragedies playing out in hospitals in so many areas. And I want to just underscore that what some of my colleagues have said, we have an opportunity. Our city has really responded in just the way we hoped they would. They've responded with compliance for the most part to these orders. As I sit here at my computer hours and hours each day in various Zoom meetings, I can see out the window on what's a pretty busy street, and there are lots of people walking by with their masks. And so, we had this opportunity to talk about it earlier, that if you are someone who has the ability to stay home, that is still what you should be doing. If you need to be in a public place, having that mask on really helps protect those who don't have the choice about whether or not to be engaging in their essential work. And so, like my colleagues, I'm going to continue to emphasize, number one, staying home as the best choice. And then two, going out, protecting yourself and others by wearing masks. So I thank you to the community who has responded in that way. I hope that we will continue to keep really informed about those models that were presented to us today, and watch carefully hospitalizations and the other factors that our medical professionals suggested are the ways to make sure that we're aware and can respond quickly if the situation changes here in Austin. Aaron, thank you for scheduling this. I look forward to our future conversations on this subject.
Thank you. Does anybody else want to speak that I haven't called on?
Mayor, you called on me, but it was a question I meant to ask the modeler, and I just think an important point needs to be made about an earlier discussion about the modeling and how even counties like rural counties, they don't have hospitals. So their folks get sent to our hospitals. And so a question is, and that was a concern about the patchwork of regulation that we had before the entire state order was put into place, was that, these models seem to be based on our activity here in Travis County, but we could continue doing all the great stuff that we're doing here, and other counties now have the opportunity to loosen their restrictions. And so I just want to remind folks that I'm grateful for how we've come together as a community, but it's important for our neighboring counties, and everybody really, but our hospitals are affected by surrounding counties' decisions as well. So I hope people remember that as well.
Mayor Pro Tem, that's a really good point. The modeling that you saw today with respect to hospitalization represents a 5-county catchment basin for exactly that reason. But, if things go really bad, really fast, we're going to be taxed at an even much wider area than those 5 counties. That's a really good point. Councilmember Kitchen, you want to say something before I close? You're on mute, I think, Mayor Kitchen.
Yes, just quickly, and you may be wanting to address this. So Mayor, I want to ask that you just, I know you'll be doing this, but just ask if you take a minute to help the public understand what the next steps are now that we have received the governor's order. So could you speak to that as we close?
I will. Thank you. First, I'm really proud to be part of this council, and I think that all the points that I would want to make, I think have been touched on. This is a council that is really unified, I think, in our perspective and our approach, and the resolve to work to make sure that we keep the community absolutely as safe as it can be. I wish the governor had given us a little bit more time to start here, because I think we have 3 institutional structural deficiencies in our city right now that even another week or 2 would have helped with. But each one of these, the governor has offered support on. So let me preface it by saying to the governor, we need your help, especially in these 3 areas. First, testing. 26,000 tests a day in the state would mean that we're supposed to be doing 1,250 tests or so here in Austin, Travis County, and we're not at that number. We're going to need help with testing. We're going to need help with testing that has really quick turnarounds. We're going to need help with the supplies that make testing possible, the swabs and the medium. We need help with testing in order to be able to get up to the levels that are necessary for us to be able to see and find infections in our area so that we can quickly isolate them, and so that we can do surveillance across our entire community so we can gauge how changes in behavior are impacting infection. Second, we need help with contact tracing. The governor has introduced a plan that's supposed to come out next week, and some new 1,000 people for the state with contact tracing. If our numbers start going up, and even if they don't, we need help with that. We really need a statewide system, and while we're told that's going to happen, I wish we had waited till it was already in place and tested and ready to go, because contact tracing crosses jurisdictional lines. So we need that help, but it's more than something that can be automated. All of the data that I've seen demonstrates that contact tracing works best absent, being able to track people by their phones. It works best when you actually have people on the phone calling other people to actually walk them through their historic contacts over the last several days. And the third area that we really need help with, and I wish we were in a position to say that we were easing when we had this in a better place, is with respect to nursing homes. This is a cruel virus. It's a cruel virus because it really does attack the people that are real susceptible and real vulnerable. It's our elderly in nursing homes that have additional illnesses and diseases, and this virus just, it treats those people like they're kindling in a forest fire. We need help with our nursing homes. We need help staffing the homes. We need help with people so that we can literally build cocoons around those folks that are our most vulnerable. But we've started the process, and we will catch up on those three things, hopefully with the state's help, and we'll do that. We'll do that quickly. But the other concern I have with what the governor laid out is the expectation that in 2 weeks we'll know whether the changes that we're making on May 1st, what impact they actually have. As you heard this morning, all of the experts, all of the doctors, all of the modelers tell us that you really need 3, probably 4 weeks in order to have any policy change actually manifest itself downstream into hospitalizations so that you can begin to see really what the impact is of a policy change. Because at the end of the day, we don't know. The governor doesn't know. None of us know what relaxing social and business interactions is going to do to the spike. So we're going to do it, and then we're going to watch it. We're going to watch it like hawks so that if we see numbers coming, we can shut it down and come back to exactly where we are today. And that's the concern. Maybe the governor has overshot, but we should be able to see those numbers in time for us to be able to self-correct and shut it down. That's has been the benefit of the work that we have done as a community over the last month. It was hard work, and when we started that work, we weren't sure whether we were going to be able to shut it down or how long it would take. We know those answers, and that is ultimately what will protect us as we try something new. But we're not going to know in 2 weeks. We need a greater amount of time in order to be able to get that done. What's going to happen next with respect to us is the county judge and I will be sitting down with the doctors and the scientists and the health professionals and talk about what we do with our local orders. As you know, our local orders expire on May 8th. We're going to be talking about extending those. We're going to be talking about extending them earlier than May 8th. And as we start those conversations now, we'll be back in touch with respect to how we're going to approach new orders in our city. In the meantime, I would urge everybody, as my colleagues did, to remember that this virus is just as infectious and deadly today as it was the second week in March and the first week in March when we actually started taking actions in this city. To the degree that you can, please abide by the stay-at-home, work-safe order. Stay at home if you can. I know that I'm going to be staying at home as much as I can, and so will Diane. As you go out, please wear the face covering. The governor said yesterday that that's not something that we can arrest people for or fine them for. Well, frankly, we weren't arresting people or fining people for it over the last 3 weeks, but pretty much everybody is doing it, and everybody needs to continue to do that. I hope that no one in this city goes into any business that's not getting people to wear face coverings. Trying as hard as they can to get everyone to wear face coverings. It's something that we should all be doing, not to protect ourselves, but out of respect for and a selfless desire to make safe the people that are around us, which is what masks do. We're going to come out with the guidance in our city of what the things that we need to do in Austin to keep our community safe. And then we're gonna hold up and elevate and reward those businesses and companies that are willing to go that extra mile to help keep our communities safe. At the end of the day, as a community, both individually and then collectively, we decide what it is that is the appropriate conduct in our city, and we have to continue doing that. So, to the degree you can stay home, and continue to stay 6 feet away, continue to wear masks. And the county judge and I and the city and the county generally will be in touch real shortly with respect to the orders in our city. With that, if no one else has anything else to say, then I'll go ahead and adjourn this special called meeting of the City Council today. Here it is, 1:26 on April 28th. Colleagues, it was good to see you all. Stay safe.
But I let them keep the claws. I found the lions, or maybe they found me. It could have been bad luck, could have been my destiny. I played dead, but my pulse was too loud. The hyenas giggled as the lions formed a crowd. I played dead, the buzzards in the tree waited for the lions to make a meal out of me. So don't mess with the mighty, mighty jungle. Swim through the ocean, meet the fish in the sea.